Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of nephrotic syndrome. So in the nephrotic syndrome, the patient with nephrotic syndrome will present with insidious the patient with nephrotic syndrome will present with insidious onset of generalized edema without a decrease in urine output. The patient complains of presence of passing a frothy urine. Mainly this passing of frothy urine is due to the presence of protein. The patient is passing frothy urine due to the presence of protein, and nephrotic syndrome is actually associated with increased increased low density lipoproteins. There can be increased triglycerides are seen, and there can be decreased high density lipoproteins are seen. Patient with nephrotic syndrome can develop spontaneous peripheral the patient with nephrotic syndrome can develop spontaneous peripheral arterial or venous thrombosis also. Then
thank you and thank you for watching.